time. We appreciate all of our new guests and those who spend time with us every single Wednesday. If you have any questions or you want to be a part of the meeting, just make sure that you let us know. We have a total open forum. Thank you for being with us.
Good evening. This is Dana Peoples. I'm Assistant Treasurer for the Minority Freedom Community Fund. I just want to say welcome to the call. So happy to have you all here, and thank you for your time. And I can't wait for us to share some valuable information.
Alrighty, thank you, Dana. Oh, I'm sorry. Go ahead, Kayla.
Hi, I'm Kayla Thomas, the chair of the Youth Advisory Committee, and I just want to say thank you for being on here tonight.
Thank you, Kayla. Are there any other volunteers or board members on the call that would like to introduce themselves before we get started? All right, so for those of you who are not joined on the Zoom app, we are sharing slides so that the people that are on the Zoom app or on the Zoom client can see our screen and see our slides. If there is information that you hear that you would like to see, please know that these meetings are recorded and also broadcasted to Facebook Live, but you can also request copies of materials that we share if you contact us afterward. I would like to start this meeting first by having Crystal Hepburn from the Detroit Health Department just give an update in regards to the COVID-19 health pandemic that we're all in and still in. There has been, as we all know, a rise in COVID-19 infections as the country is reopening for economic reasons. We see that people are becoming more lax, and so I thought it's been a while since we've had Crystal speak to us, and I just wanted to continue to reinforce and reiterate how important it is to stay safe during this time. So we're going to kick off our meeting with some comments from Crystal. I am again sharing slides for this portion of the presentation. If you're on the phone and you need to unmute yourself, you can press *6 to do so. Otherwise, you can stay muted and know that you can contact us at any of the phone numbers or email addresses that you hear during this call. So Crystal, I am going to turn it over to you at this time.
Hi, good afternoon, and thank you so much for having me once again. It's a pleasure to be here on behalf of the Detroit Health Department. As you did mention, we are seeing an uptick in the COVID positive cases. So we do want to go ahead and reiterate to individuals to continue to maintain their safety for their health, as well as for many other families, members, friends, by continuing to wear your mask, social distance, and continue your hand hygiene. So today I brought some information about contact tracing. Many have heard about it, and some people are not so familiar as to why are we doing contact tracing. Perhaps they may not answer the phone. So I just have a few slides here that I can briefly touch on, answer any questions individuals may have, because our goal at the Detroit Health Department is to ensure that residents, whether you live, work, or play in Detroit, continue to be healthy and safe by preventing and slowing the spread of the COVID-19, both to ourselves, to our residents, perhaps other individuals that are frequently visiting some of the restaurants or entertainment complexes in Detroit. As of today, these are using figures earlier this morning. I'm compared to see what the numbers were from Monday to now because it's just been a couple days. So currently, as of Monday, we had 11,572 confirmed cases. As of this morning, the positive cases in Detroit raised to 11,609. That was an increase of 37 cases just over the 2 days. Thankfully, we have not had a drastic spike in deaths, but we have gone from 1,441 to 1,443. In comparison, across the state of Michigan for the 1 day from June 29th to June 30th, there was an increase of 373 positive cases as well as 32 deaths. So we do see that it's now increasing. I know that many are enjoying the beautiful weather, getting back together with family and friends that they haven't seen, or expanding their social circles. This is still a time to take every precaution until we are clear of the coronavirus or COVID in our community. Our next slide will show exactly where it is in our community. Throughout Detroit, in each and every zip code, we do have some positive cases. And this particular legend and map is available on our Detroit Health Department's website, so individuals can go ahead and monitor it. And the legend goes ahead and goes from lightest, which is the lowest number of cases in that particular zip code, to the highest number of cases, making it a darker shade of green. So as you can see, there is some variances, but COVID is in each and every zip code. The one with the highest zip code for positive cases is going to be 48235, which currently had, as of this morning, 1,048 positive cases. But keep in mind, the population in that zip code is 45,000, roughly, individuals that go ahead and live in that particular zip code. Many other zip codes that may have smaller numbers may be filled with different types of industry, restaurants, entertainment. So please make sure when you are verifying or comparing it to other zip codes, on our website, we have a standardized data relation that will be on a percent per 100,000. So you can get a comparable reading and a comparable number. Okay, moving on to the next slide, you can see that everyone still has a role to play. It's essential that we continue to follow the preventative measures to stop and slow the spread of the virus. We've seen a huge uptick in cases across the southern United States. Once things started to go ahead and open up a little bit more, some of the precautions were set aside. And even today, you can see that the governor is aware and trying to take every precaution by limiting the number of individuals and declaring bars or alcohol sales in bars inside are no longer available. Individuals can go ahead and frequent the establishment through takeout, delivery, various other things to try to avoid large masses of people indoors socializing together. We are all responsible for our actions as well as for our community. We want to make sure that we are not continuing to go ahead and pass this on to other family members, other friends as we're getting together. So we want to take personal responsibility and making sure that you're being safe for yourself and everyone around you. Continue to wear your mask comfortably fitted over your nose and your mouth. We know that this particular virus is transmitted through respiratory droplets when individuals talk, cough, or sneeze. So it's essential that we go ahead and wear the mask properly to go ahead and eliminate or minimize the amount of risk. Continue to go ahead and maintain your social distancing and hand hygiene. So contact tracing. We've heard a lot about contact tracing and case investigation. This is used by health departments to prevent the spread of infectious diseases. In general, contact tracing involves identifying the individual who has the infected disease or the infectious disease and identify those that they may have been in contact with to see if they've been exposed, identify their risk, and also work with them to interrupt the disease transmission to avoid it continually being in our community. Okay, so contact tracing typically involves an individual from the health department calling to interview the individual that has the COVID positive case. At that particular point, we're trying to identify who they've been in contact with over at least the last 2 days within 6 feet of an individual for at least 15 minutes. Once we obtain that information, we do notify the contacts of the potential exposure. We want to make sure individuals are aware of their risk. All of the private health information is kept confidential. So that first person who was identified as being COVID positive, that information is not relayed to anyone else when we identify and share the information with the contacts. Also, during the particular time period in which we're notifying the contacts, we want to make sure that they're educated, provide them with guidance, support, information for monitoring their signs and symptoms, and if they have a high risk of being in close proximity with that particular individual for a long duration, we will refer that particular contact to testing, whether they have symptoms or not. We know many are asymptomatic, so they are not experiencing or showing any outward signs of the virus within them. But we do want to make sure that they do get tested and are aware whether or not they are carriers of the particular virus. We want individuals to continue to monitor themselves as well as any other individuals that they may have come in contact with for the last few days for any signs and symptoms. Of course, if somebody has been in close proximity, we ask that they self-quarantine at home. So as we're reaching out to individuals, they may be required to self-quarantine. That may affect them getting groceries or food deliveries and various other items. So at the health department, we do try to provide them with resources and contacts to ensure that they can continue to obtain the services such as groceries so they can continue to be healthy and monitor at home. The next picture will just show how quickly the contact tracing and how quickly the virus can spread. So here we have one individual that has tested positive with COVID. From there, we try to identify, as mentioned, the location, the number of individuals in which they've gone ahead and been in contact with. From there, it's been identified who they might have been in contact with. In this particular example, 2 contacts have been identified. Once going through the information, we will go ahead and confirm whether or not they have been within 6 feet of that infected person for more than 15 minutes. Okay, and once we get that information, we do go ahead and reach out to those individuals or those contacts that the positive COVID individual was around. We ask whether or not they've had a mask, if they've been experiencing any signs and symptoms. So the first individual you see was close in proximity and they were wearing a mask. So their risk is diminished. However, it is not eliminated. Okay, the second person identified notes, perhaps, no, they weren't within 6 feet. They might have been just saying hello from the driveway, say about 10 feet. So that risk is even lower. So once we continue to speak to the individual in the context of that positive individual, you'll see here that that primary individual who was in close proximity while wearing a mask has been asked whether or not they have any signs and symptoms. If they answered yes, we would use that as a presumptive case and continue to inquire whether or not they have had contact with other individuals. For the individual that was identified as having a safe distance, being at least, say for example, 10 feet while saying hello on the driveway, they have not been experiencing any signs or symptoms. We would stop the contact tracing with that particular individual, provide them with guidance and support and education to continue to self-monitor. Although the risk is very, very low, they should still know the signs and symptoms just in case. Okay, so once it's been identified that they have signs and symptoms, as I mentioned, we go through the additional contact tracing and identify if there's other individuals that may have been at risk of that secondary person and continue to ask them to monitor their signs and symptoms and self-quarantine. If they have no other symptoms, that would be considered resolved at that particular point. We do need everyone's help to continue to go ahead and monitor our signs and symptoms and help with contact tracing. So the fewer locations that individuals go to, the less likely of passing on viruses. So make sure that as you are going out and about, you're going out for necessary reasons that may be required. If you become sick at all, please stay home and notify anyone that you have been in contact with within 6 feet for at least 15 minutes or more within those 2 days before you first develop the COVID-19 signs and symptoms. Please answer your phone. Many health departments are contacting individuals. Some may be familiar with the phone number, some may not. There may be a voicemail that's left just asking for a return phone call. If you would kindly call, we just want to make sure individuals are aware of their exposure, and perhaps if there's any other education, testing information, guidance that they may need, that we can go ahead and pass that information along as well. Okay, and just as wrapping up, we want to make sure that we provide you with some community resources. At the Detroit Health Department, oh, sorry, I missed the one with privacy concerns, as well as the new app. So as mentioned, privacy concerns, all of your information is kept private. We do not share any information whatsoever. Your identity is not revealed to any individual or any of the contact tracing in which we go ahead and speak to. There are some recent concerns over technology, and our next slide will go ahead and identify those concerns. Of course, this is a global pandemic. Many individuals are trying to work together to make sure that they can identify different types of solution. So Apple and Google have been working together around the world with many governments and health authorities to find software or create an app to go ahead and make sure that they can use these particular technical tools to combat the virus and save lives. So Google and Apple have announced the joint effort to use Bluetooth technology to help governments and health agencies reduce the spread of the virus. This is something that is available to individuals to opt in. They want to make sure that user privacy and security is central to the design. As part of the partnership, Google and Apple have released draft documentation, and you would be able to more than likely find it on your phone already. At the moment, the Detroit Health Department has not been receiving information related to this. We just want to make sure that you are aware of it. Some individuals have noticed it's on here and want to make sure that their information is treated accordingly, of course. So there is a number of apps that individuals can go ahead and look at and identify if they want to go ahead and search, whether it be the Play Store or the Apple iTunes or App Store, that they can download the apps. Contact tracing will slow the spread of COVID because it can help us identify, educate, and inform others on what they can do to stop the spread. So again, if the health department does call, please feel free to give us a call back. We are available for additional guidance, information. You may have some questions or need some information for testing that we'd be able to help you with. At the Detroit Health Department, we do have a community hotline available Monday through Friday from 8 a.m. until 8 p.m. The phone number is 313-876-4000. Individuals can press number 1. There will be somebody to answer their phone call, again, Monday through Friday, 8 a.m. until 8 p.m. On weekends, you're welcome to leave a voicemail and somebody will get back to you. We also have an email address which is monitored. It's DHDOUTBREAK detroitmi.gov. That is DHD outbreak at detroitmi.gov. If you need any resources, whether you're a small business looking for financial information, looking for reopening information, testing sites, signs and symptoms, if you're looking for posters to put up at your workplace or in your community organization, we do have those resources available on our Detroit Health Department website, as well as our current statistics. That website is detroitmi.gov/coronavirus. Also, I know you have some representatives in Detroit and many others across the nation. We do have some wonderful community resources for individuals available at the website covid313.org. That's COVID 313, as in the number, .org. Here you'll be able to find information if you're looking for assistance with your tax information, foreclosure, water department, education supplements, maybe some of those organizations to provide you with home delivery if you're self-quarantining. We also have information from the CDC. As we all know, this is a brand new virus that many of us are learning daily. So the CDC is the hub for the United States in which it's constantly getting the data, providing the guidance, updating guidelines, and providing us the best practices. So it will go ahead and change from time to time. So please feel free to consult the CDC. And together, the World Health Organization is also combining the information from other countries around the world. We are learning from each other during this particular time. It's something that is continually evolving, and we're continually learning from others. So please feel free to go ahead and make sure that you're using trusted resources. And if you have any questions or concerns, I'd be happy to take those now too.
Thank you so much, Crystal. This was extremely helpful as always, and we definitely appreciate your time and sharing with us. I would like to invite anyone on the call, whether you're on Zoom or on Facebook, to please share any questions that you have for Crystal in regards to contact tracing or COVID-19. You can put them in the chat. You can unmute yourself. Whatever your preference is. Alternatively, you can reach out to that hotline number that was shared if you would like to ask your question more anonymously. I know that Crystal is representing the Detroit Health Department, and we, the Minority Freedom Community Fund, are a national organization, but a lot, if not virtually all of the information outside of the statistical numbers, a lot of the information is applicable nationwide, and so we still find it extremely helpful to share this information with our callers because a lot of the precautions and safety measures that are recommended by the Detroit Health Department apply to people everywhere. Again, if you are on the phone and you are not on the Zoom app, you can press *6 to unmute yourself. While I'm waiting for people to unmute themselves, I will make note. So one of the things that Crystal talked about was that we all are needed to help with the contact tracing. There is actually a free contact tracing course offered by Coursera. I think it's just about 4 hours or so, and you can actually get certified in contact tracing. I know that a lot of health departments across the country are seeking volunteers to help with that effort. And so that's a nice way for people to help combat the impacts of coronavirus by getting that certification, and it's free. I will make sure that we drop a link to that course, but again, it's Coursera, and if you just search COVID-19 contact tracing, that opportunity will populate. Are there any other questions for Crystal before we move on? All right. Well, hearing none, Crystal, again, thank you so much for sharing with us, and these slides were extremely helpful. We appreciate you and hope you have a great evening.
Thank you, and I wish everyone a happy and healthy 4th of July holiday. May you please get together safely with family and friends and continue to go ahead and make sure you share this information with many others. And at the Detroit Health Department, again, we are here to serve. Thank you very much. Have a wonderful night.
Thank you. All righty. So at this time, I would like to invite, we do have another guest speaker who is on the call right now, Mr. Jeffrey Taylor. And Mr. Taylor, I would like to invite you to unmute yourself. I know we're switching gears completely. So we're going from physical health to financial health. So not too hard of a switch. We have had the opportunity and pleasure of hearing from Mr. Taylor at one of our community calls earlier on, but he is back to share some exciting and new updates and programs that he is offering to people. So, Mr. Taylor, the floor is yours.
Oh my goodness, thank you so much, Ms. Brookins, and to the minority community, family and board members and guests and friends and everybody else. How you all doing? Real quick, I am a financial strategist, and I have two very important seminars coming up. The one seminar focuses on protecting your money from loss. This particular session, we're going to be going through case studies on how we've helped other families to protect themselves from economic loss. And one of the examples we're going to walk through is where one of our clients recently retired. And in the course of that, with everything that's going on, had she not followed our instructions, she would have lost $150,000. So we helped her avoid a $150,000 loss. I don't know about you, but I need to protect my money from loss. That class is going to be on July the 13th at 7:30 p.m. in an online session. The second class is going to be July the 11th, which is a week from Saturday, where we're going to be talking about how colleges award funding. This is going to be a very powerful class because we're going to show you how colleges award money regardless of your income. So regardless if you have a higher income or lower income, you need to be in this class. Now, what we're going to do, because we want to support the Minority Freedom Community Fund regularly. So I did something that could be a huge benefit while being a blessing to the community at the same time. So all of you who attend our workshops and complete a survey just to tell us, hey, did you get anything out of it? Was it worth your time? You know, typical survey type questions. It'll take a minute to fill it out after the class. And every person who fills out a survey, who's a guest or affiliated directly or indirectly with the Minority Freedom Community Fund, we are going to give a donation of $10. So if we have 20 persons show up to college class, 20 persons show up for the 4 Ways to Protect Your Money class, guess what? We're going to be writing a nice check to the Minority Freedom Community Fund. They'll get that money the week of the 13th. So after that 13th class, within 48 to 72 hours, we'll have a Cash App or whatever to that organization. We want to do something like this on a regular basis. To learn more and to get an invite to either class, text me at 313-304-2274. Again, that's 313-304-2274. And what I need you to do is put your name in there and just say Minority Freedom, so I know it's you, and then we'll verify that and make sure you get that invitation. Thank you very much, Ms. Brookins, and I hope everybody has an amazing, wonderful, fantastic, beautiful, healthy 4th of July weekend.
Thank you so much, Mr. Taylor. Again, for those of you that are on Zoom, we are sharing information in the chat, but for those that are on the call, I know we're sharing a lot of numbers and links, and we're recording this meeting so you can reference it later, or you can contact us if you need information sent to you directly. Thank you so much, Mr. Taylor, for that generous offer. We encourage you all to take Mr. Taylor up on that offer and learn some things about how to prepare for retirement and for college and those college savings and those sorts of things. So I think that this is something that can be extremely helpful and valuable to our community, and encourage you all to take advantage of the offer. All right, so at this time, I do want to just share a couple of updates with the community in regards to the things that are going on with the Minority Freedom Community Fund. Our task force in particular, at the last meeting, we talked about how we had received a large influx of emergency assistance applications, and we had developed a process to sort of prioritize those. I am happy to report that all of the 33 applications, about 10 of them were categorized as high priority, and all of those have been awarded. And we are now working on awarding and processing the medium priority applications for assistance. And so we just want to continue to thank you all for donating, for spreading the word, and for being honest and asking for help and assistance when you need it, because we cannot do what we do if there was no one here for us to help. So even if you are receiving rather than giving, you're still helping us in our organization. So keep that in mind. Also, we have several organizational updates, but before I move on to our organizational updates, I just want to pause for a millisecond to allow anyone else within the organization that has any updates in relation to our COVID-19 task force and planning and things that we've been doing with the organization. All right, the millisecond is up. And so I'll go on to just describe a couple of organizational updates. And so this past Saturday, we held our first public board meeting. Thank you to everyone who is on the call that participated in that board meeting. We will be circulating a recording to everyone that is subscribed to our e-newsletter. You'll receive that in your email sometime this week, if not next week. But we just want to remind you all that as a community-based and community-led organization, we value and prioritize transparency. And so our virtual board meetings are public so that we can fulfill that goal. And so we encourage you, if you weren't able to attend this time, to attend our next meeting. Our meetings are quarterly, so the next one will be in September. The date has not been set, but you will be aware and made aware when that date is set. We had a really great time. We did vote on bringing on a new board member, Ms. Tasha Williams, and we had some very interesting and exciting reports from each of our committees, and use a little time to interact with people. So we got to play virtual bingo just to break up some of the business of the meeting and get to engage in a more fun way. So that was very fun. And if anyone on the call that was at that board meeting that is not a board member and would like to share any words about the meeting, you can feel free to do so. In addition to the board meeting, we also had our first board member orientation. I say that because as again, a national organization, we really strive and aim to have representation from across the country, either as a volunteer or on our board. And so we are constantly recruiting board members. And so in order to make sure that everyone is up to speed and to sort of start to build a cohesiveness among the board, we did have an orientation that was also very informative yet interactive and engaging, and we will continue to have board member events so that our board members can come together. Speaking of board members, we also have a new board member nominee who is actually on the call today, and so she, Ms. Erin Holder, will be voted in, or an action will be made on her candidacy sometime this month. But we are extremely excited to have her. And Ms. Erin, if you want to say a few words, no pressure if you don't, but if you do want to unmute yourself and say a few words about yourself and what you're hoping to do with the Minority Freedom Community Fund, you can feel free to unmute yourself and do so.
Hi, everyone. Thanks so much for having me on the call. I'm really, really excited to be joining your team as a volunteer and hopefully as a board member in the near future. I am based in Boston, Massachusetts. I've been a leader on Harvard Diversity, Equity, Inclusion projects for the past few years, and I'm excited to contribute to the Minority Freedom Community Fund's community. Really looking forward to learning more about what you guys are doing and really getting all of this going.
Thank you so much. All right, and as I mentioned, we're constantly growing. We've had several new volunteers from across the country join us recently, including our first dedicated grant writers. This is important and of note to you all because right now we all of our fundraising efforts have been laser focused on supporting COVID-19 relief. And so all of our other programs that we aim to have as an organization have not been funded and so have not been able to take off. And so having these dedicated grant writers who can assist in soliciting institutional giving and more larger gifts will be very essential and core to us being able to fulfill our mission. And so just wanted to update the community on that. I want to also encourage you all to, again, subscribe to our e-newsletters. Right now, that is the most, besides these community calls each week, our e-newsletters are the most valuable way to stay connected with our organization if you're not a volunteer or a board member. We do have a website that we will be updating and adding information to eventually, but we have not done that yet. So our website is not necessarily the best place to find information about what we're doing and what we're working on all the time. And so we encourage you to subscribe to our e-newsletter or to subscribe to our text alerts, preferably the e-newsletter, just so that you can stay updated on what's going on. In the coming weeks, our community engagement director and community engagement arm of the organization will begin to use those e-newsletters as a way to disseminate information to you all in combination with these calls and our social media platforms. And so it's really important that you are, reading those emails, engaging with those emails, and giving us your feedback. So those are the updates that I have internally for the organization. At this time, I would like to open the call up to any callers who have any comments, any feedback, any questions, any concerns that you would like to share with us or with other callers at this time. Again, this is the community Q&A portion of our meeting. Again, we use these meetings as a way to not only share information, but to find out from the community what you want us to be focusing on and what you want us to be working on, because this is, we are very much so designed with you in mind and led by you and your needs. And so this is an opportunity for you to voice any questions, any concerns, again, that you might have, either things that you've heard on this call or prior calls, or things that you've seen in the news. There is no shortage of things in the news right now, so please do not be bashful. This is a safe space, and we really, really value your thoughts and your opinions.
I don't have a question. I was just going to introduce myself for everyone that's on the call. My name is Ava Peoples, and I'm a part of the Youth Advisory Committee. And I'm happy that everybody's on this call. And stay safe, everyone.
Thank you, Miss Ava. All right. Are there any other questions, comments, concerns?
I would like to pose a question to our youth on the call, if I could.
Yes.
So I know that the governor made an announcement yesterday about how schools will move forward, with the fall. So I'd like to know from our youth, how are you feeling about it? I know how I feel as a parent and as an educator, but I would like to know how our young people feel.
I feel that I feel like that we should be back in school by the fall, because like if we're not, it's gonna be kind of hard to it's not gonna be hard, but like when everybody gets back to school, it's gonna be probably like in March or something if it's not in the fall. I feel like that everybody's just like, if they didn't do their work and stuff over the summer, they're gonna be like, I don't remember how to do this, how we do this. So I hope that we go back to school in the fall. And yeah.
Are you not concerned about your health or anything? Do you feel nervous or anxious or a little?
I'm kind of worried because like if we do go back in the fall, like I think that we're doing like half of the week in school and half of the week out of school. But like I still am gonna be kind of nervous. Like I'm not trying to go hug people and stuff, but like, keep your distance and stuff. So
Good
yeah.
answer. Please keep your distance.
That is so odd. So I was actually speaking, I was just getting ready to talk about the same subject, but I didn't unmute. So Dana beat me to it.
Sorry. I gave you a wait. I waited a little bit.
It's okay. I was talking. But I was listening to everything and that came out today. And our superintendent sent out some possible strategies that they're going to have. And as a parent, that made me a little concerned. And they also gave an option where if you want to continue virtual school, to call a number. So it's kind of up in the air. I'm very nervous. I actually saw that one of the Red Robin restaurants in Michigan had closed today because several employees had caught the virus. So I'm trying to think of like my kids going into the cafeteria to eat, or just being in gym, or just how they are going to function in school. And so I have my own nervousness about sending my kids to school. I don't know if Kayla has to say about it, but it's a lot. And then the little kids are not being forced to wear masks, but the older kids are. It's just a lot of questions I have right now.
There's definitely a lot. If I could describe it with one word, it's uncertain. Working in, within the education system, I feel like I can't be certain until we actually get to the fall, because, just like she relinquished the bars from being able to serve indoors today, they opened it and then they closed it because it didn't work out. So I think on my end, there are a lot of parents who are unsure, a lot of parents who are just like, no, they're not coming back. We're going to stick with online for right now until it's actually safe, because flu season is September, October. So, or start September, October. So, like you said, with grades 6 through 12 wearing masks, grades, below 6th grade, no masks. They did say no assemblies. They want to have the kids eat in their classrooms, specials come into the rooms instead of the kids traveling to specials. So there are a lot of moving pieces when you think about the way schools run. But I will say one good thing that I think will come out of it is, in the event that we do have to close schools or we have snow days in the winter, there will be a plan in place to keep education going. That's probably the one positive that I can say may have come out of this whole ordeal, is that now we have a plan to where hopefully we have less, less stops in terms of education.
Right. And I don't know if there are any other teachers on the call, but we're looking at this from the student's view and the parent's view. I can't imagine the teachers and how they're feeling with possibly having to wear a mask all day, or not being able to be close to the students, or having to just rearrange and restructure their entire classroom to keep an entire group safe every day. That has to be stressful. I don't know what their thoughts are or what's happening or going through their minds as well, but I feel for them as well.
Excuse me.
Oh, go ahead. Yes.
I personally want to get back to school, but I'm aware that there will be issues with people's health, and I understand that a lot of parents, like you said, are worried about their kids' health and about what's going to be going on. So yes, I want to get back to school and some people probably need it so they can be with other children and will be able to be in the environment that that is regular for them. But they need to protect their health, and I think we should stay home and not go back to school in the fall until things are sorted out and we can make sure no one's health will be harmed.
Thank you, Mackenzie and/or Jessica, whoever that was. Kayla, I see that you unmuted yourself, so I'm really interested to hear what you have to say about this.
Okay, hi everyone, this is Kayla, and I will be going to 7th grade this fall, and I'm really nervous because I want to see my friends, but at the same time, I'm really concerned about my health and safety because like having physical contact and still being in the same classrooms. And I'm also concerned that if we do go back to school and not do online school, if they're going to limit the amount of kids in the classrooms, there's going to be less opportunities for kids to be in school.
Right. Right.
And I know I discussed the first announcement I discussed with Kayla, and when we were speaking about the paths in the hallway and how that's going to change, and the desks being apart, and just a lot of the rules that they're going to have to follow. I know she had made mention that we might as well stay home because the kids are going to be so focused on following these new rules, what they can't do, what they can do, people getting sick. It's going to be a distraction from their learning. And that's the most important thing about school, is their learning. Socialization as well, but just them being in a space where they're focused on their education. And that should be important.
Hello?
Marcia, I see you unmuted yourself. Did you want to say something?
No, it's Sydney actually, because I was listening to the conversation. Hi. So my name is Sydney. I'm a senior at the University of Michigan. And I was listening to some of your comments about schools opening back up, and I thought maybe I could add the perspective of a college student. For one, I think that I'm sort of in a blessed situation where I get to be in college when this is all happening, because I can't even imagine what it must be like to have to deal with like educating your child through a pandemic when they're a child, you know? And one thing I've been thinking about since you guys have been talking, and when Kayla was making her comment, albeit really important that, you get the social interaction and all of that. And I can't remember who it was earlier, Mackenzie or Jessica, who were speaking earlier, who was saying that, like they think we should stay home. And I totally get that. But at the same time, though, I worry so much all the time about Detroit, like Detroit's little ones, like K-8 for the most part, because with the pandemic, the reason why why Gretchen Whitmer and why we had to shut down schools so much earlier than other schools in other districts and other states was because of the lack of resources that children have in the city of Detroit and the prevalence of like low socioeconomic status around the city. So I'm sort of in a catch-22 in my opinion about it, because I worry a lot about the safety and health of kids, but I also really worry about the deficit of access to, the digital infrastructure to educate a kindergartner, a Black, Detroit kindergartner at home when there are lots of kids in the house, or if there's, not enough food in the home and the kids were depending on going to school to get food, or, other resources that they need throughout the day. So it's kind of like a weird situation. So I'm trying to see it from both perspectives, but yeah. So I thought I'd just add that also, because I'm studying education policy at Michigan. So I'm trying to think about it from a lot of different lenses. I'm lucky because a lot of colleges, it's possible to do the classes that I do in a remote way. Also, the thing about the high schoolers doing half the week in person, half not in person, that doesn't seem to make any sense to me at all. So that's just my opinion on that. I don't see how that makes any sense. And I think that they should make it, if they're going to give people the option to be remote, they should make it really possible to be remote. What I mean by that is like giving students laptops, giving them Wi-Fi, giving them the things they need to operate from home, if their parents can support that.
Absolutely. Thank you so much, Sydney. Sydney is an amazing young lady, and I hope that one day her heart guides her and leads her to be a volunteer for the Minority Freedom Community Fund along with her mom. I see Mackenzie and Jessica, Mackenzie and/or Jessica, I see a hand raised. I don't know if you did that intentionally. If you have something else to say, you can go ahead and unmute yourself. And then I see Mary Alexander also had something to say.
I did, and so this was Jessica earlier. That was Mackenzie, and I think as a parent and just as a provider in the area, part of what my kids start yelling. Part of what I think about is that in terms of looking at things from an educational approach, I think the kids in their education and trying to make sure they stay on target. But I think a large consideration, not only what's already been and what's going forward, is the sort of that biopsychosocial emotional approach in terms of, well, how are we helping the kids to transition? I know for myself, walking into a grocery store or being in a setting where everyone has on masks and they're keeping distance and there's these plastic dividers, that takes an emotional toll on just watching and seeing what that looks like in our environment. And so how do you prepare children for that? We pulled them out of school, we threw them into a system, and now we're getting ready to throw them into another one. And I think, what is the preparation? How do we transition? You have preschool to get you ready for kindergarten, right? Essentially. So what gets prepared to walk into this space beyond just, okay, they have to get their education. How are we dealing with their emotional health? How are we dealing with their psychological health? How are we looking at how it impacts their bodies and their minds, and how different it is from kids who were expecting different things to graduate or to be in different kinds of classrooms. And so I think it has to be looked at in a wider range when I looked at the plan in terms of going back, and I just don't think that it addresses that piece. And so that's a bit concerning for me in terms of whether or not they go back and just the safety of being able to have safe interactions. They can't really guarantee that because kids will make choices of their own and parents are going to make choices of their own.
Hi, this is Mary from Baltimore. How you doing? Sorry for jumping on kind of late. Policies and such, when we're talking about the kids, we always thinking about those kids who can do for themselves, but no one really ever stretches the thought of what we're going to do for our kids who have disabilities and learning differences. Many of them need much more support And when you're talking about policy, the young lady who was just on saying she studies policy, you cannot offer an education to one population and not the other. It just goes beyond black and white. And so, you know, those who are advocates for children, make sure you're inclusive in your communication to your leadership in your you know, respective jurisdictions, because they can't come up with one solution without thinking in terms of all the children. That's all.
That's a very good comment. Thank you, Mary. I also, since you brought that up, I spoke with a friend who has a granddaughter who did not do well during the last part of school because she has ADHD, and they could not keep her in front of the computer. She could not stay focused. There's services, resources that help her in school, but to just sit at a table or in front of a computer and do all of her work, it didn't work. So we have to make sure that we are thinking about students who have disabilities or issues with computers or learning, need to be face-to-face, need to be touched. Those are all things we do need to make sure that we consider. I have a 7-year-old who's going to the 2nd grade. I substitute teach. I've taught in the kindergarten classroom and the 1st grade classroom. I cannot see maintaining what they're rolling out. It's hard enough day to day to say, for them to keep things clean, to keep not touch each other, not grab each other, not touch each other's space. It's overwhelming for kids who are just getting adjusted to being in a classroom, in a group environment with other kids. You have one teacher in the classroom who's already overwhelmed, moving every second of the day. And to try to keep all of those babies safe at one time, they're still babies at that age. And that's a lot. I mean, to me, they would have to look at having multiple adults in the classroom monitoring the kids in the space and them making sure that they're keeping things clean, because we know, and I have a little one, they're not the cleanest. I mean, they're little and they're constantly touching and putting their hands in their mouths and touching their faces. So I'm more concerned about my youngest kid than Kayla, who's 11, who can take care of herself. But she has asthma, and so you want me to have a mask on her all day?
No.
So that's another, caveat to that as well. So just a lot of concerns, but Mary, you brought up a lot, and Sydney, I appreciate you jumping in, giving a younger adult perspective, because these are all things that we should be thinking about, and writing or calling your districts and asking them about it so they can make sure that they're thinking about what we're thinking about on our side of it.
I think that's a perfect segue into what I wanted to say to wrap up this portion of the meeting is, so in addition to wanting to hear and allow you all to vent and express yourselves, we also use this information to formulate how we act. And so 2 things that I'm taking away from this conversation. One was just mentioned by Nakia, writing your districts, writing your legislators, letting them know your concerns, sharing your ideas and your thoughts with them, so that they can have your perspective, your children's perspectives and their needs in mind as they're making decisions and plans and those sorts of things. If you need assistance getting the contact information for your district, please contact us. You can send us an email to info@mifreedomcf.org, or you can text us at 810-377-5165 and request that information. In addition, we will try to spend some time as an organization thinking about ways to get kids, especially kids with different learning abilities, prepared both socially and mentally for returning to school, and do it from a student and parent-led perspective, and not just the business perspective or the sort of legislator-led perspective that's sort of happening right now. We're going to do so in combination with some of the resources that we've shared in the past for students, especially students with disabilities and just the social and mental health for students with disabilities, minority students, students that are suffering from mental health issues because either onset by COVID-19 or pre-existing. And so we really want to make sure that we use our capacity to help design and inform and lead initiatives that can get our children prepared for whatever school will look like in the fall. We don't know what it is. We hear ideas right now, but we just want to make sure that we're doing everything that we can to prepare children. On the subject of education, I did share a link in our chat for people that are on the Zoom link, and you can use that link to schedule virtual tutoring services for your children or your family or friends who have children that are in grades K through 3rd. This is virtual tutoring services provided by one of our partners. You can go to jamtime.simplybook.me to book virtual tutoring services at 1 hour increments for your K through 3rd scholar. All right, at this time, if there are no other topics or things, we try to keep these meetings to an hour now. They used to be a little long and I felt guilty. So I would like to wrap up this call and just remind you all that we will be having these calls every week. But now I would like to transition to our fun time. It is now raffle time. And again, we offer these community raffles, not as a way to bribe you, but just as a token of our appreciation for sharing your insights, for spending your time with us, for engaging with us. We extremely value your thoughts and your opinions. And so we do have a winner that we've selected for this week's call. Again, special thank you to our anonymous donor for sponsoring our community raffle so that we do not have to use any donated dollars or funds or any of our organizational funds to pay for our raffle. The winner this week, if you could send your cash tag name to us via text to 810-377-5165. Miss Mary Alexander, you are this week's winner. So if you could send us, yay! If you could send us your Cash App information. If you don't have Cash App, we can work with you as well, but Cash App is the primary method that we distribute funds just because it's simple, it's free, it's easy, and a lot of people have it. And so if you could send that information to us, we would truly appreciate it. Congratulations. All right, at this time, I would like to thank everyone for being on the call, for sharing your insights. I do want to just remind you all that we are still fundraising for our Minority Community Response Emergency Aid Fund. And so to donate to that fund, you can text the keyword COVID Fund, COVID-FUND, all one word, to the number 44321. And that will take you to a link or to a page that will allow you to donate or fundraise for that emergency assistance fund. So even if you yourself don't have the resources, you could share that, create a fundraiser and share it with your networks. That will be very helpful to us. Again, we do have several applications that we still are trying to fundraise so that we can meet and provide awards to and assistance to. And so anything that you can do to help in that effort will be helpful. I do want to remind everyone to take advantage of Mr. Jeff Taylor's offer to attend those courses. Each person that subscribes or signs up for that course, we will receive a donation as well. And so that will be very helpful for us for fulfilling our mission. Also want to just encourage you to subscribe to our e-newsletters if you have not done so already. If you have not, you can drop your email address in the chat box and we will add you to our e-newsletter campaign. And I hope that you all have amazing evenings. Thank you again for spending your time with us. And we look forward to seeing you again next week. Thank you all.
Ms. Brookins?
Yes.